Welcome to NSG 315 Study Session 12, Diseases of the GIT. Introduction. The gastrointestinal diseases refers to disease involving the gastrointestinal tract, namely the esophagus, the stomach, small intestine, large intestine, and the rectum, and the accessory organs of digestion, the liver, gallbladder, and pancreas. In this study session, you'll be learning about different diseases of the GIT, which includes peptic ulcer, colorectal cancer, colon cancer, and cholecystitis. Learning outcomes for this study session include, at the end of the study session, you should be able to 1. Discuss peptic ulcer, 2. Explain colorectal cancer, 3. Explain colon cancer, and 4. Discuss cholecystitis. Peptic ulcer. A peptic ulcer is a distinct breach in the mucosal lining of the stomach, that is gastric ulcer, or the first part of the small intestine, the duodenal ulcer, a result of caustic effect of acid and pepsin in the lumen. Histologically, peptic ulcer is identified as necrosis of the mucosa, which produces lesion equal to or greater than 0.5 centimeter, that is 1/5 feet. Symptoms: due to gastric irritation by pepsin and HCl, burning or gurning pain in the epigastrium and related to eating. Eating relieves pain, and taking alkali, heartburn. Vomiting, a complication following obstruction of the pyloric orifice. Emesis contain mainly undigested food. Bleeding evidenced by passage of tarry stool on palpation. There is pain in the epigastrium. Colorectal cancer. Introduction. Tumors of the rectum and colon. Second most common internal cancers in the developed world. Fast-growing incidence among developing countries, attributed to post-modernization, acculturation, modification in feeding pattern, and lifestyle. Epidemiology. Around 60% of cases were diagnosed in the developed world. It is estimated that worldwide in 2008, 1.23 billion new cases of colorectal cancer were clinically diagnosed, and that it killed 608,000 people. Globally, more than 1 million people get colorectal cancer every year, resulting in about 715,000 deaths as of 2010, up from 490,000 in 1990. Colon cancer. Cancers that are confined within the wall of the colon are often curable with surgery, while cancer that are spread widely around the body is usually not curable, and management then focuses on extending the person's life via chemotherapy and improving quality of life, according to Wikipedia 2014. Stage 0 colon cancer, known as cancer in situ, meaning the cancer is located in the mucosa, moist tissue lining in the colon or rectum. Removal of polypectomy is the usual treatment. The figure 12.9 below shows stage 0 cancer. Stage 1 colon cancer. The cancer has grown through the mucosa and is invaded the muscularis, that is muscular coat. Treatment is surgery to remove the tumor and some surrounding lymph nodes. Figure 12.10 below shows the picture of stage 1 cancer. Stage 2 colon cancer. The cancer has grown beyond the muscularis of the colon or rectum, but has not spread to the lymph nodes. Stage 2 colon cancer is treated with surgery and in some cases chemotherapy after surgery. Stage 2 rectal cancer is treated with surgery, radiation therapy, and chemotherapy, which is illustrated in figure 12.11 below. Stage 3 colon cancer. The cancer has spread to the regional lymph nodes, that is, lymph nodes near the colon and rectum. Stage 3 colon cancer is treated with surgery and chemotherapy. Stage 3 rectal cancer is treated with surgery, radiation therapy, and chemotherapy, which is illustrated in figure 12.12 below. Stage 4 colon cancer. The cancer has spread outside of the colon or rectum to other areas of the body. Stage 4 cancer is treated with chemotherapy. Surgery to remove the colon or rectal tumor may or may not be done. Additional surgery to remove metastasis may also be done in carefully selected patients. Figure 12.3 below shows the picture of stage 4 cancer. Summary of study session 12. In this study session, you've learned the following. 1. A peptic ulcer is a distinct breach in the mucosal lining of the stomach, that is gastric ulcer, or the first part of the small intestine, the duodenal ulcer, a result of caustic effects of acid and pepsin in the lumen. Histologically, peptic ulcer is identified as necrosis of the mucosa which produces lesions equal to or greater than 0.5 centimeter, as 1/5 inches. Number 2, colorectal tumor is tumors of the rectum and colon. Second most common internal cancers in the developed countries. Fast-growing incidence among developing countries attributed to post-modernization, acculturation, modification in feeding patterns, and lifestyle. Number 3, colon cancer and cancers that are confined within the wall of the colon and are often curable with surgery, while cancer that are spread widely around the body is usually not curable, and management then focuses on extending the person's life via chemotherapy and improving quality of life. Number 4, cholecystitis is a disease affecting the gallbladder. Most cases are caused by gallstones. Normally, if one is diagnosed with cholecystitis, the person is admitted to the hospital for treatment with painkillers, fluids, and sometimes antibiotics directly into the vein. The inflammation may settle down with treatment. Thank you. We've come to the end of this study session.